Hello, hello, hello. This is Toya coming to you with some information about Goodpasture syndrome, also known as anti-GBM disease or anti-glomerular basement membrane disease. It's an autoimmune disease that affects not just the kidneys, but the lungs and the kidneys. And it's due to an antibody that attacks the collagen of the kidneys and of the lungs. And as we know, collagen is so essential in wound healing and blood clotting and obtaining hemostasis. Goodpasture syndrome. Great question. Thank you for asking. So due to the alveolar hemorrhage, because of the disruption of the collagen from the antibodies, hemoptysis is a telltale sign. And also because of the glomerular nephritis, hematuria is another sign that is very telling of Goodpasture syndrome, but a combination of the two. In addition to that, and because of the bleeding, of course, anemia. We've already talked about hematuria, hypertension, nausea, vomiting, fatigue, coughing up blood, dyspnea, and sometimes even edema. Diagnose Goodpasture syndrome. Great question. We've already talked about what the disease is, and now we've already discussed some signs and symptoms, ideally the hematuria and hemoptysis, but what are some labs that can further narrow down our differential diagnoses list? Good question. So, urinalysis. See if there's actually blood present in the urine. Is there protein present in the urine? Get a serum BUN and creatinine, which can be gathered from your CMP or your BNP, to see if the kidneys have taken any kind of hit. Also, hit or injury. Also, look at your CBC. Is your hemoglobin and hematocrit being affected? A chest x-ray, getting a biopsy. So what are some treatments? 3 things: immunosuppressive agents like cyclophosphamide, corticosteroids, and plasmapheresis. Thank you for listening.